Today's webinar is entitled Social Return on Investment. It's part of a series of webinars being co-hosted by the Chronic Disease Prevention Alliance of Canada, or CDPAC, and the Public Health Agency of Canada's Centre for Chronic Disease Prevention. We're extremely pleased to be co-hosting this webinar on SROI, a topic that is becoming ever more important when we think about measuring the broad value of health promotion and chronic disease prevention activities. My name is Bill Callery. I'll be moderating the webinar. I'm Manager of Programs and Knowledge Exchange at CDPAC. And for those of you who aren't familiar with CDPAC, we're a network of many of Canada's largest national nonprofit and professional health organizations sharing a common vision for an integrated system of research, surveillance, policies, and programs for maintaining health and preventing chronic disease in Canada. We've listed our social media and website coordinates at the bottom, so I encourage you to connect with us, learn about upcoming events, and check out materials from our past events and webinars. So before we get started, on behalf of CDPAC, as well as our co-host, the Public Health Agency of Canada, I'd like to wish you a very warm welcome and thank you for joining us today. So our presenter today, very pleased to present Craig Joyce. Craig is an analyst with the Public Health Agency of Canada's Centre for Chronic Disease Prevention. He holds a Master's of Public Administration as well as a Master of Library and Information Studies. And Craig's been involved in social return on investment analyses for the past 2 years and is working towards his accreditation as a practitioner later this year.
All right, so thank you for that introduction, and thanks to everyone for joining us this afternoon just to walk through some of the work that we've been doing around social return on investment here at the Centre for Chronic Disease Prevention at the Public Health Agency of Canada. So this is something we've been doing actually quite a lot of work on over the last probably 12 to 18 months. And so we're really excited to be sort of at this point where we can sort of share a little bit about what we've done, how we've applied it within our context. This, I hope, will be an interesting presentation because I'm going to do a bit of an overview of what social return on investment is, just so that we can all get on the same page as to what the method involves. But what's really interesting is we've actually sort of already applied this within our context, so we have some tangible examples of, for example, how we've valued certain outcomes that are important to us in our context. So I hope that you'll all find that instructive, because I know that there's a lot of interest in this method as it starts to sort of take off in Canada. I want to hit next slide. It should center onto the page called the method and overview. So just by way of an overview, obviously social return on investment is a kind of return on investment. It enables you to sort of generate a ratio for every dollar invested, you generate a certain number of dollars and cents in social value returned. The difference between a social return and a standard return on investment is part of the process involves you applying a monetary value to what we would traditionally consider an intangible good. So in our case here at CCDP, the Centre for Chronic Disease Prevention, that would be things like fruit and vegetable consumption or increased levels of physical activity. So later in the presentation, I'll walk you through some of the techniques that we're employing to sort of tease out what the monetary value of those things are. But what that allows you to do is sort of to bring to light some of the things that are most important about investments that would normally sort of fall off the table or get lost in sort of standard return on investment type analysis that would only look at standard sort of monetary economic values. I do have a bit of a short video. It's actually taken from Spain, where they have employed this method in the context of a supportive housing type program that they run there. It's from the city of Barcelona.
Barcelona City Council Home Care Service provides support and aid for dependent residents in their own home with the aim of detecting, preventing and promoting their personal autonomy. The Home Care Service received an investment of nearly 53 million euros in 2012 to care for more than 80,000 people throughout the year. Since the law on dependency went into effect in 2007, the number of users has doubled, going from 8,143 to more than 80,000 users in 2012. The resources earmarked for this program have also increased, from 70.2 million euros in 2007 to 53 million in 2012. With this significant investment, it is key to know the value of and social changes brought about by these resources, which go beyond the direct benefits of the service. For this reason, the Barcelona City Council is taking a step forward, applying an innovative, internationally proven methodology to see the real impact of the social investment. This new method, known as social return on investment, assesses the investment in terms of the social value generated. It takes into account not only the resources allotted, but also the savings generated by the administration's investment. Applying this innovative calculation method, the Barcelona City Council's home care service has shown that for each euro invested in the program, 3.13 euros are generated. This means if we calculate the average investment per user at 2,744 euros, the social impact generated for each is 8,589 euros. The return on investment is clear. Direct users of the service receive the most direct impact on their quality of life. Users of the home care service turn to the Government of Catalonia's social and healthcare services less frequently, which entails savings for the Catalan administration. The Spanish administration also benefits thanks to income from taxes and fewer people drawing unemployment benefits. The care environment, thanks to the fact that their family members participate in the home care service, has greater work opportunities and more free time. Finally, the companies that provide this service also see the economic benefit of the activity subcontracted by the City Council. In the current context, it is key to know the real value of social investment and understand that it can't be analysed only in terms of its initial cost or the direct benefits of the service. The benefits go much further, and the Barcelona City Council aims to take advantage of this opportunity to lead this paradigm shift.
But one of the reasons why I like to show that video is because one of the things it does really well is it teases out the different kinds of value that can be created in the context of a program. And that's sort of really core to the sort of concept of social return on investment, because value can mean many things. It's very broadly construed. So in some cases, value is very easily identified. So things where there might be a traded good have prices. That's a form of social value. Salaries that are paid to people is the social value for skilled labor, for example. Taxes, those types of things are all ways to sort of value things socially. Other cases, the value is less tangible. So things like healthy eating and fruit and vegetable consumption, it's not obvious what the monetary value of these kinds of behaviors are, but there are ways that we can start to see what they might be valued at if they were. In sort of standard monetary terms. So what I'll do is I'll just walk people through the 6 steps of SROI. So you should be looking at a slide with 6 bars. And what this is social return on investment is actually a standardized international methodology. It really started, I would say, in the mid-90s in the US with an organization called REDF. It was looking for a way to sort of express the value of some of its community investments that it was doing at that time in ways that people would understand from an investment perspective, and was finding that a lot of the tools and mechanisms in the evaluation field broadly were a bit wanting in that regard. And so that organization started to put together what became the standard social return on investment methodology. And if you Google that organization and SROI, REDF, and social return on investment, you'll see some of the early work that they did. It really took off in the UK, along with some of the social innovation work that they've been undertaking within the last decade, I would say, in the area of behavioral economics and that type of thing. And from there, it has sort of exploded, and there's number of firms in Canada that specialize in this. One of the firms in particular we've done a lot of work with, and some of the work that I'll be presenting actually was developed by them, is CDPAC Strategies, which is based in Calgary and Toronto. So Canada's really, it's really starting to take off within Canada, and more organizations are getting interested in doing this. But it is standardized according to and there's an international sort of governing body that oversees the method, and there are 6 standard steps that you go through when you undertake an SROI analysis. And if you Google this Social Return on Investment International Network, You'll find the standard guidance on that website, and you will see these steps, and the language that you see on this graphic is taken from that documentation. So this is all available online for detail. But I'll walk you through briefly what the different steps entail. The first step is basically a scoping exercise, and part of that is identifying key stakeholders. So again, what the Barcelona video is really useful for demonstrating is that value can look very different from different stakeholders' perspectives. So whether it's the ultimate beneficiaries of a service versus other service providers where you might be alleviating a burden, or a system where you might be diverting cases from, and there's a cost savings argument, value could look very different depending on who the stakeholder is. So the first step is really to sort of scope out what it is you're looking to do an analysis on, and identify the various stakeholders that would experience some material change as a result of the activities of the program that you're analyzing. And the second step, the mapping outcome step, this is similar to a logic model exercise, but you're really sort of laying out a chain of results for each stakeholder group, recognizing that change will look differently between those various groups, or could look differently between those various groups. But also part of this, because it is a return on investment, there is a bit of an emphasis here on sort of teasing out what the various inputs to the program are. And this can be a fairly straightforward exercise. These are often very easily to monetize, so program budgets, salaries, human resources, that type of thing, are what you consider inputs into a social return on investment, much like you would a more traditional return on investment. And then from there, sort of mapping out what the chain of results looks like by stakeholder group. Those steps are generally done in consultation with stakeholders. That's a really core part of social return on investment that the guidance developed by the International Network really emphasizes, because in the conduct of this, we need to not make any assumptions about what's valuable to different stakeholder groups. It's meant to be teased out in a participatory manner, and then you sort of assign value from there. So we're not making any assumptions about what's valuable to people. We're actually working with people to identify what that value is in whatever terms they can use to describe it, and then from an analysis perspective, work from that, as opposed to sort of trying to impose our own views as to what's valuable for others. Make sense? Step 3 is also an interesting step because often a lot of people sort of confuse social return on investment as sort of a replacement for traditional evaluation techniques. And that's not actually the case. They're really complementary in many regards. Evaluation is actually a step of SROI, and basically what an SROI does is assign a value to an evaluation result. So evidencing outcomes and giving them a value, that's the third step. Here you're identifying, as you would, outcome indicators, collecting data, determining how long outcomes last, that type of thing. You do assign value, but the main part is having some evidence base for what you're doing. There are two kinds of social return on investment analysis that can be done, and those are forecast versus evaluative. So in the case of an evaluative one, where you're collecting data on outcomes and you understand the level of change that's occurring, that's fairly easy to understand. In the case of a forecast, where perhaps you're looking to project what the social return of a planned set of activities will be that you haven't yet undertaken, it can be a little more difficult to provide evidence around sort of how much of an outcome you intend to or expect to achieve. Here, in the context of a forecast, what you're really doing is sort of relying on the published literature, the established evidence base around similar type programs to come to an understanding of what that value creation might look like when you do implement your activities. So where there's a published study on something similar to what you're doing, if you're implementing a program that has been implemented in another jurisdiction and it's been evaluated there, you can basically substitute that type of evidence in to come up with a reasonable set of assumptions around what the value creation for a program might look like if you haven't yet done it. So the bulk of step 3 is really around sort of establishing the evidence base for the initiative, but it's also where you assign monetary value to the outcomes that you're achieving. And I won't talk too much about that here because I have actual, as I mentioned, specific examples around techniques that can be used to do this in the second part of the presentation. We'll move along to step 4, around establishing impact. SROI analysis distinguishes outcomes from impact, and the difference is the outcome is sort of like what's achieved, but the impact is really what can be basically attributed to the activities that you undertook. How much of that value can you actually claim? So there's a number of steps that you actually go through in step 4 to tease out what the impact is as distinct from the outcomes that were achieved. And before I sort of go through what those 4 terms mean, part of the guidance for social return on investment is that it's a principles-based approach, and there are 7 sort of standard principles that you need to sort of comply with in the conduct of social return on investment. And one of them is around being conservative. And the importance of that is that you don't want to conduct the analysis in a way that inflates the ratio such that readers of your report or people who are exposed to it when it's done might have some suspicion that that's actually what occurred, or that you're trying to be opportunistic about how you're presenting the value of a program that you might have a vested interest in. So as you're going through the analysis and making different assumptions around what goes into the model that you're developing, there's a requirement that as an analyst that you be, one, transparent about the choices that you're making as you go through so that someone else can replicate the model that you're making, but also that you're being conservative in the assumptions that you're making. So if at any point you have a choice between 2 values and one is lower than the other, it's usually best, generally speaking, to go with a lower value, such that when you finish your analysis and come up with your ratio, you can say confidently that we know that the value is at least this and probably more. But if you're inviting sort of if you're being generous in any of your assumptions, you will likely invite some suspicion, and that could detract from what you're sort of trying to do with the analysis, which is to bring to surface the value of social programs, which are hard to sort of quantify from an evaluation perspective. So that being said, with step 4 around establishing impact, there is a series of steps that you go through where you'll actually take away sort of chunks of value from what you've valued in step 3 in the interest of being conservative. And there are 4 of these in particular, and I'll just go through them one by one because they're really important to understand. The first one is around dead weight, and that's an estimation of the amount of the outcome that would have occurred whether or not you undertook your activities in your program or not. So the example that I like to give here from, and I know that most people won't be from a public health perspective, but most of my examples are public health examples, so bear with me, is around smoking cessation programs, where there's a fairly well-established evidence base around stages of change. So we know that when people enter smoking cessation programs, generally speaking, some are at a stage where they're just ready to make that change. They're ready to quit. And they've gone through a series of steps to get there, and they're just looking for an opportunity that will enable them to do that. We can assume in those types of cases that whether your program was available to them or not, that those people were already motivated to make that change and would have found something whether you did your program or not. So we wouldn't claim a certain amount of value for the number of people that we would expect were at a stage where they were going to quit regardless, and you just happened to come along with your program and it was convenient for them to use that. So that's one area where we take away some amount of value. It can be difficult to sort of estimate how much you should take away, but wherever you can look to the literature to sort of come up with an estimate as to what that might look like, and have some references and some evidence base behind those assumptions, that's usually a good practice. So the second one is called displacement, and this one is we have to assume that there's an opportunity cost to our activities, and that when we're getting people to do certain things, that may be detracting them from doing other things, for example, some of which might be positive. And so one of the examples I like to give is in social programming when we're working with perhaps an at-risk population. We have a number of programs in the after-school period for vulnerable youth, for example. And where I would apply this type of an assumption would be, we're getting those kinds of youth to be active in that after-school period, and that's positive. We have to assume that might be taking away from something else in their context that is equally important to them. So if, say, we have an older youth in an after-school activity program and we're getting them more active, but that they would otherwise be providing free after-school care to younger siblings, then we need to understand that we're adding, while we're doing something positive, we're also adding a strain into that context for that individual, and that we need to account for those types of, you might call them unintended consequences, where they occur. So you will actually take off a chunk of value for that as well. And when I say a chunk of value within the model that you're setting up, you're actually taking away percentages of value as you've calculated them in step 3. Attribution is, I think most people, at least from an evaluation perspective, have a sense of what attribution means, but it's the extent to which you can actually attribute the change and the value that you've calculated to your set of activities. So often we have to assume that there are a number of things that are influencing people's behavior in their environments, and that just because they're in a program, let's say, that's geared toward healthy eating, and we see that they improve their eating habits, that's all down to our set of activities. There's lots of things that might be influencing that change, including our program, but it might be marketing, it might be some other nutrition program in a school environment, or any number of things. So you always have to make an assumption that not everything that you see in terms of results from a program can naturally be attributed to your program, and you need to be sort of conservative around how much of that you claim for yourself based on the investment that you've made within your organization. Another area where attribution is relevant is in the context of partnerships, or in organizations that benefit from sort of service delivery networks that are already in place, that those activities couldn't occur without those types of support. And so it's not all about the organization that's doing the program, but the other networks and services and whatnot that they mobilize in order to reach their audience. So there's a bit of an attribution issue there as well, and that there's a number of dependencies that the program has, and you need to be sensitive to how much of that claim can realistically be claimed by your particular program in that sort of more complex context. And then the last one is drop-off, and this is you have to make an assumption that let's say you have a group of people that achieve an outcome, that some of those individuals will start to drop off over time, and that will no longer demonstrate that outcome over a long period of time. So I often think about this in the context of some of the healthy eating work that some of the projects that we support do. Insofar as if they're supplying food, healthy snacks to youth in an after-school period, for example, that's adding value in the short term while the youth are in the program, but it may not actually be addressing the underlying food security issues that family might experience outside of the program. So when the program ends, that outcome doesn't really sustain itself beyond the end of the program. We wouldn't claim value for that type of short-term outcome over any long period of time. So dead weight, displacement, attribution, and drop-off, they can mean many things depending on the context of the program, but you do need to come up with estimates around how much you can reasonably claim. And this is a useful sort of step to sort of build a bit of credibility in the model, that you're not sort of trying to claim too much or do too much within it, such that people would be skeptical of the ratio at the end of the day. I'm not going to say too much about steps 5 and 6. Step 5, there's a lot of sort of accounting that goes into it. So you're looking at things like the time value of money. So let's say if you're projecting value over a 5-year period of time, we know that because of things like inflation, that $1 today is not the same as $1 tomorrow. The buying power of that dollar would be very different. So there are steps that you can take within the model that you're building to account for that. And that does get complicated, but there are actual sort of spreadsheets that you can actually procure. CDPAC Strategies has one, for example, which we've used in the past, but you can find some online as well that meet international guidelines for the conduct of social return on investment analysis. So a lot of this is actually structured within the spreadsheets for you, so it's not as difficult as it might look. The last thing I wanted to point out on step 5 was around the sensitivity analysis, because this is a really interesting feature. Most of you, as I've been going through this, have probably been thinking, well, yes, but any number of people could come at the same program and do the same SROI analysis, but come up with different values for things and therefore different ratios at the end of the day. So there's a lot of subjectivity that's being built into this as you're going through and making choices and assumptions about things at every step. One of the black here. One of the, hold on. I'm back, sorry about that. One of the principles of social return on investment is that you be transparent about any choices or decisions that are being made as you're moving through the analysis. So these actually get documented so that people can replicate your analysis, basically, but also so that people know what choices that you've made and assumptions that you've made. And in the sensitivity analysis, what you will do is where you've made major assumptions about things, you can actually fluctuate those variables within the model to see how sensitive the end result is to that assumption. So basically, if you see that you've made an assumption and when you test it within the sensitivity, it doesn't change your overall ratio that much, then within the context of the model, it's not very sensitive to that. Like, it's not a very sensitive assumption that you've made. If you find that the ratio does change quite a bit based on that assumption, as you sort of move the variable up and down within the model, then we would say that's sensitive. It's not a problem. You will probably always see that when you do it, but you just sort of document that and just be transparent about the fact that, you know, if someone else had made a different assumption, they might have come up with a different ratio. But we've made this assumption for these reasons, and this is what we came up with. Where I found this useful when we were working with CDPAC to put together one of our analyses over the past year was we were having trouble sort of coming to agreement as to what combination of assumptions we wanted to have within a certain model for a certain part of the analysis we were doing. And what we did was we had them actually generate what the range of value could be using the sensitivity analysis to sort of move that variable up and down the sliding scale from the minimum to the maximum to say, we can't really agree on specifically what it is, but we know it's somewhere within this range, and this is what it would look like in terms of the ratio. So that can be a helpful tool as well, where you're feeling that something has been really subjective. You can sort of build that in and demonstrate to your audience that it falls somewhere within this range, and it might not be a very large range. So let's move ahead to the next slide. So here at the Center for Chronic Disease Prevention, as I mentioned at the start, we've invested a lot of time sort of developing models for social return on investment for our programs here around healthy living and chronic disease prevention. And one of the reasons for that is that it's our senior management became really interested in this in the context of some of the work that we've been doing around building multi-sectoral partnerships, for example. So there's a bit of a movement within our organization to get other sectors that traditionally haven't gotten involved as much as we might have liked in healthy living and chronic disease prevention activities to see a role for themselves within that, whereas they hadn't in the past. So for us, social return on investment allows us to do a couple of things. And the first one is around articulating what we achieve, even where some of what we achieve is really distal or hard to quantify. So in our policy realm, the area of social policy and public health policy, it's often very, very difficult for us to demonstrate sort of even outcomes in chronic disease prevention because they're so distal to us. We know that internationally, international organizations are more ready to invest in infectious disease prevention initiatives than they are chronic disease prevention initiatives. So when I think about something like malaria nets, for example, it's quite obvious that when you buy the nets and you use the nets, that the rates of the disease go down, and you can see right away both the economic but also the social impact of that, and that's a sort of more attractive thing to invest in. It's less risky. Whereas when you're talking about some of the things that we have policy authority for and that we are trying to get others to sort of participate in with us, it's things like chronic disease prevention over the long term, getting people more active, obesity, those types of things that don't change in the short term. So for us, this gave us a bit of a means to start to quantify what our impact might look like in a way that we really haven't been able to do in the past. So that was interesting to us for that reason. Another is just around language, because we're really using the language of money here, which is a universal language, and we're really trying to engage other sectors, including the private sector. It was useful for us to sort of translate some of what we're doing into a return on investment of some sort in order to have more meaningful conversations around what investment could look like and why others should invest along with us. So that was another benefit. And then the third reason that gave this some policy relevance for us was around some of what we do is not necessarily around sort of evidence-based programs that we know that work, but more around social innovation and testing out new ideas. And so we wanted to have a way to sort of express, like, what's the value of doing that? Like, what's the return on taking that kind of a risk, especially when we're asking others to participate with us through, say, a matched funding arrangement or that type of thing. I just have a bit of a sort of a classic quote that pops up for anyone that's involved in the evaluation field. Not everything that can be counted counts, and not everything that counts can be counted. So really what social return is doing is it's allowing us to count in some creative ways things that we've assumed couldn't be quantified in the past. And I'll get back to that in just a minute when I walk you through some of the actual techniques that we've used in our analysis. Go ahead to the next slide. We have a number of investments here at the Centre for Chronic Disease Prevention, many around, as you would expect, disease prevention. So for the major chronic diseases, which include cancer, cardiovascular, diabetes, and a bit of respiratory, which we look at through tobacco cessation mainly. And we have a healthy living fund as well. We also have a small fund for breast cancer. So we do a variety of things here, but over the last few years, we've sort of coalesced all our funds and sort of developed a bit of a different funding model where we actually have a matched funding arrangement where we no longer will just fund an NGO. The NGO has to match the dollars that we give them from another party, and that's often the private sector. So that allows us really to double our investment in the short term because we don't have a huge number of funds. The other thing that we've done is we've increased our length of our contribution agreements from, I would say on average, they were around 1 to 2 years in the past, to we're moving towards an average of 3, but up to 5 years. So we're looking for basically longer, sort of more sustainable, impactful investments with some matched funding component that will have a more measurable effect on behavior in the long term. And that's the other really important part of the program context is we've really moved away from the awareness raising type of activity for the most part, with the understanding that most Canadians at this point really know that living a healthy lifestyle has many benefits to them, including chronic disease prevention benefits. So a lot of that work has been done over the last generation or so. There have been some really good high-profile initiatives like PHAC over the last, number of decades, I guess, that have really raised the awareness of Canadians. And we felt it was really time, from a policy perspective, to move away from sort of awareness raising and start to get people activated to take tangible steps to improve their health through what we call common risk factors for chronic disease. For us, the big one is physical inactivity. So the vast majority of projects that we fund are usually doing something around promoting physical activity among some segment of the population, often youth, because that's a sort of efficient stage of life to invest within. But it can be anyone, anywhere, because we know that the evidence is showing us that very few Canadians are physically active enough to achieve chronic disease prevention benefits. So that's our program context. Basically, we fund a number of different types of interventions. Some can have it evidence-based, some can be what we would call a social innovation, where we might be testing something new. And some recent examples of that would be we've done some work with Loyalty One and the YMCA to test an incentive-based behavior change program within YMCA gyms. So we're able to, we've been working with them for, I'd say, probably almost 3 years now, and we've seen that that initiative has actually been successful in getting people to go to the gym incrementally more often than they were at the same time the last year. So that's been a successful initiative, but it's one of our examples of what we would consider a very non-conventional approach to health promotion programming in our type of area, and we're more and more interested in testing out different types of social innovations, what we call behavioral economics, a lot of the types of things that the Cabinet Office in the UK has tested out over the last little while. So that's our program context. I'm not going to talk too much more about that. Can we move ahead to the next slide? So the multifactorial element is really sort of central to our model. And one of the questions that we had when we started our work with PHAC strategies was, is there a value to partnership models that we see ourselves as co-creating and putting into place to benefit the health of Canadians? So rather than just funding an organization to do a set of activities with a certain segment of the population, can we bring two groups together that might have different resources to bear on the problem and get them to work together in sort of a new and creative way to address that problem, which has been a difficult problem to solve? And again, we'll say that's physical inactivity. We do more than that, but that's generally a lot of what we do. And PHAC Strategies was able to do some clever research around this and find that we can actually monetize the partnership model in and of itself. So there is a value add in working together as opposed to working in isolation. And what they did was they looked to a study that was actually completed by the Bill and Melinda Gates Foundation. And what they had done with the study is they set up a bit of a experimental design where they had two groups of organizations that were both in matched funding relationships with the Bill and Melinda Gates Foundation. So they had a funding relationship with Bill and Melinda Gates. But the difference between the two groups was that one group was transparent about their relationship with the foundation. The other group was not, and they were surprised to see that the group that was transparent about their relationship with Bill and Melinda Gates was able to leverage in their fundraising efforts up to 40% more in dollars raised than the group that didn't disclose their relationship with Bill and Melinda Gates. So basically what the study was showing was that there is a really tangible gain from having credible partnerships in matched funding relationships that allows organizations to leverage additional funds over and above what they get through their funding agreement with the funding partner. So we were really intrigued by this because basically the model that they were looking at was really more or less identical to what we were doing. So within our social return on investment analysis, we've given ourselves an additional sort of 40% value add because of our partnership model that we work within. And for our senior managers, they got really excited about this because anecdotally, they know that this actually is true, that some of the organizations that we've been funding who we've had partner with other organizations have found that they're finding it easier to bring others to the table when they hear more about sort of the more exciting work that they're doing in collaboration with, new and different types of partners. It really does generate a lot of excitement and buzz. And that has actually translated for many of our funding recipients into additional funds leveraged. We know that many, although we have a dollar for dollar matched funding relationship for most of our programs, that many of them are able to leverage more than that. So that was an important thing for us to quantify. So we'll move ahead to the next slide. The really core thing that we wanted to assign a monetary value to was around behavior change in our ultimate beneficiaries. So our whole raison d'etre as an organization is to improve the health of Canadians by preventing chronic disease, by promoting healthy lifestyles. And that, as I mentioned, often means increasing physical activity or improving healthy eating habits within various segments of the population. So this was really our difficult nut to crack for us because, as you can imagine, healthy eating and physical activity aren't obvious candidates for finding a monetary value to. But what we were able to do was sort of look to the literature developed by health economists and other types of economists. And they have actually developed, anyone who has an economics background will be familiar with some of these techniques that I'm about to talk to. But economists actually have some really creative ways of teasing out monetary values for what we would call public goods or non-excludable goods or intangible goods. So there are probably three techniques. We looked at two. One is a fairly standard technique, and the other is a more creative one. And the standard technique is really standard sort of bread and butter economics, basic economics work, and it's called revealed preference. So if we can zoom in. So basically, we surmise that behavior change would be valued in a two-step process for us. So we wanted to assign a monetary value to the immediate behavior change that we saw from people who participated in the programs that we supported while the programs were being run. So let's say what that would mean tangibly is if we had an after-school physical activity program for youth that ran during the school year, that the extra physical activity that those kids got during that period of time that they spent in that program was value created, but it was short-term value created. The real win for us is those that make the shift to a lifestyle change, and they adopt that behavior over a longer period of time. So it's a bit of a no-brainer. When you put a kid in a physical activity program, you're going to see that they get more physically active because essentially they're kind of being forced to in the context of that program. It's what that program does. But when the program ends, has their attitude around physical activity shifted in any way, and do they take up more physical activity than they would have otherwise in the longer term? So in the short term, we've used a valuation technique called revealed preference. In the long term, we're looking at a technique that's called the life satisfaction approach. So I'll go through what revealed preference is, and that's basically what you're looking at now in the sort of turquoise part of that slide. Revealed preference is basically the theory that our actual behavior reveals our preference for certain combinations of things over others. So a really handy way to sort of tease that out is when you look at people's spending patterns, people choose to spend their money on certain things and not others. And that varies from person to person based on their preference, but when you look in aggregate, you can sort of see what mass amounts of people generally prefer to do. So our case, we wanted to apply this technique to fairly intangible behaviors, which are healthy eating and physical activity. And so the indicators for healthy eating and physical activity that we typically use here at the Public Health Agency of Canada are, for healthy eating, 5 or more fruits and vegetables consumed per day is considered a healthy diet. For physical activity, although our thinking around this is shifting towards the 24-hour cycle, the traditional evidence base is more around physical activity during leisure time. So those were really the indicators that we looked at. And we looked to the survey on household spending, which is conducted by Statistics Canada. This is what's used by the Bank of Canada as well, actually, to do some of the work that they do there. So it's a large sample size. It's representative of the population. And that was part of the benefit of this, is because we don't really know who's going to come into our programs. It could be anyone. We take a population health approach. We wanted to come up with values that were representative for the population as a whole. So we looked at the survey, and there's a category for fruits and vegetables consumption. And when we control for household size, which is 2.48 persons per people, according to that survey, per house, you end up with a value of about $509 spent on fruits and vegetables per person in Canada. And for physical activity, this was a little bit more difficult to get to, but what we did is we went through the survey and basically pulled out items that people would need to buy in order to be physically active in their recreation time. And there's a number of things in there. So there's a category for bicycles, there's a category for athletic footwear for different age categories that might be in the house, for gym memberships or recreation facility memberships, those types of things. And we added up all those values to come up with, it's about $389 per year per person. So those are really, really low values. Most people sort of react fairly negatively to those, but that's actually fairly consistent with what we know, because if people were spending a lot of money on fruits and vegetables, and they were spending a lot of money on their, physical activity and their recreation time, we probably wouldn't have a childhood obesity problem, and we probably wouldn't exist as a center, right? There wouldn't be a need, as we know that there is. So although these are very low values, it's kind of consistent with what we know about Canadians' behavior. They're not eating enough fruits and vegetables, and they're not physically active enough. It's also worth noting that because this is, I believe this excludes on-reserve First Nations, but otherwise this includes basically everyone, including, people in the far north, people in rural communities, urban, people of all levels of socioeconomic status. So when you think about the context of all the different types of Canadians you can think of, you can see why that average might be fairly low for those two indicators. Now, it is low. It's probably far lower than, it's probably a far more conservative estimate than is the reality, but again, conservative values for the purposes of SROI is actually a bit of a strength. So we know that, for example, there is physical activity that you can do in your recreation time or other time that comes freely to you. So if you live in an urban area, for example, and you walk to work, that physical activity that you're getting, it's not showing up in your spending patterns and therefore not sort of feeding into this number. So we know that it's undervaluing these behaviors to some extent. We don't know by how much, but we know that this is a good enough estimate in the short term of what people are willing to allocate in terms of spending to these, to demonstrate these two behaviors over a short period of time. So I had mentioned that we used the revealed preference approach in the short term. So that's while people are participating in programs, we wanted to show some value created, but we wanted to add an extra layer of value for that subgroup of people who participate in our programs and then afterwards adopt some level of a healthier lifestyle over a longer period of time. And so this is where we're looking at what's known as the life satisfaction approach to valuation. And this is, I would say, a fairly creative technique. I haven't seen it used in the context of health behaviors. Where it has been used has been to value what you would typically consider a non-excludable public good. So it can be used to assign values to things like clean air or clean water, or the most famous example, which is where I came across this, is it's been used to assign a value to a sense of safety and security by looking at neighborhoods where there's an experience of domestic terrorism versus neighborhoods where there isn't. So basically what you're able to do is you have to have the right data to do this, and we're actually not all the way there with this yet. We have our science staff, some of whom actually might be dialed in on the call, so maybe in the question period they can pipe up. But we're on our way to sort of developing these financial proxies using a large data set. It's the Canadian Community Health Survey. Basically what you need is a data set that has three things, which the Canadian Community Health Survey, or the CCHS, provides for us. One is a measure of household income or personal income. One is a measure of subjective well-being, and that's usually overall life satisfaction. And that's usually measured, it can be a single item, which is what we're using, which is a Likert scale. So how satisfied are you with your life overall, from very dissatisfied to completely satisfied on a scale of 1 to 5, say. And then you need to have some quantified indicators of the behavior or behaviors that you're interested in. So for us, those were, of course, physical activity and healthy eating. So in the CCHS, we have a number of questions that ask about physical activity. Some of you may have been respondents, but it asks things like, how much time per day in minutes do you spend gardening, or how much time per day do you spend walking to work or biking to work? And it goes through a number of questions like that, and actually comes up with an amount of time that people spend within a given period of time on physical activity. And then for fruit and vegetable consumption, it does something similar. It has a multiple set of questions around fruit and vegetable consumption. So it asks you, how many leafy green vegetables did you eat within the last day, 30 days, 7 days, that type of thing? How many dark orange vegetables have you eaten? And then it adds up the number that people self-report, and then comes up with an overall number for what people eat based on their 24-hour, 7-day, and 30-day recall, I believe. So those are the variables that we're using there. Basically, what you're able to do is you look at the income variable, for example, and then you ask, by what increment of income does it take to move up 1 point on the life satisfaction scale? So let's say that on average, an increase in life satisfaction by 1 point is associated with, say, 1,000 Canadian dollars. Then you ask yourself, by what increment of the behavior that we're interested in is associated with the same increase in life satisfaction? So then we might look to say, let's say fruit and vegetable consumption, that an increment of life satisfaction is associated with, say, 2 fruits and vegetables per day. We would then say that 1 fruit and vegetable is worth about $500, that you get the same amount of life satisfaction from that level of fruit and vegetable consumption as you do from an extra increment of income. So that's oversimplifying the method quite a bit, but as you can imagine, like we have a statistician working on this, and she's controlling for a number of variables that would otherwise be confounding. So anything that would impact your life satisfaction, we're controlling for. And interestingly, the last time I saw the analysis, that the more we control for things, the stronger the relationship between the behaviors that we're interested in and life satisfaction is. So when we control for things like marital status and gender and geography and all these other things, the relationships become stronger and stronger. So this is a very promising area for us, I would say. And we're pretty excited about this because, like I said, it hasn't been really done in any detail in a health environment before. So this would be sort of a bit of an advance in the area of sort of valuation. And so this is our result. For every dollar that we invest in our multi-sectoral partnerships, we generate at least $2.37 in social value. So a couple of things to note about that. So we're more than doubling the return on our investment, but we've made some pretty interesting assumptions to get there. So one is we assumed the minimum level of success. So we went right down to the basement, as I say, and said that let's make an assumption that only 1% of the people that we reach will have success in terms of outcomes over any period of time. So this is a 1% success rate for us. So the reason why we did that is that this was CDPAC Strategy's suggestion, and we wanted to see, like, if we make the minimum possible assumption, what would that look like in terms of a return? Because that kind of eliminates a lot of skepticism around what we're doing here, because no one can accuse us of being optimistic around what we're achieving in our programs, because we've assumed that 99% of the time we're going to fail. And even if we just get 1% of people moving more or eating more fruits and vegetables, that still has a pretty hefty return on our investment. The other part is the life satisfaction approach that I very briefly walked you through. We haven't actually finished that yet, so those monetary values haven't been applied yet. So that's a second level of value that's not present yet. So when we add that in, I expect that ratio will jump for us, because I expect that the monetary values that will yield for us will be more substantial than the fairly disappointing monetary values of $508 for fruit and vegetable consumption. I think it was $389 for physical activity. We think the way that the analysis is going is that the monetary values will be greater than that, which will then take our ratio up. The other thing to keep in mind is that we have not factored in the other types of social outcomes that are very likely to be generated by the types of programming that we support. So we've looked at social return very specifically from a health promotion perspective, so looking at health behaviors. But we know that many of the initiatives that we support are achieving other types of outcomes. So some of them have a literacy component, some of them have a skills building component, some of them have a crime prevention component, particularly in cases where we're working with at-risk youth in the after-school period, for example. That's often a stated objective of some of our partners. So there are other types of social value that, for our high-level analysis, we didn't consider, but that you normally would in the context of a social return. We wanted to just look and see what do we achieve in terms of social return from a public health perspective. But when we work with our partners, and we do to do analyses at project levels where we're looking at a specific intervention that we're supporting, we look more broadly at the types of outcomes that they're achieving beyond the health outcomes that we're interested in. So that adds to the value as well, and that's not reflected there as well. So that $2.37, I put it in red because it should be read with, like, there's a lot that's not there that could be there, but it's kind of nice to show that as sort of like a bit of a minimum in terms of what our return looks like. And so I think the next slide is the last slide, and I was just going to sort of sum up and then turn it over for questions.
And we'll go right into the questions and discussion period. So I'd like to thank you, Craig, for a really interesting presentation. I know there's a lot of interest in this topic. The first question that I've got here for you is a question about, I think this was on your slide with the various steps. The question is, how do you establish percent reductions for dead weights and displacements?
Right. Can be subjective. Ideally, as I mentioned on the slide, if you can, a lot of that comes from sort of looking at the literature. So oftentimes you won't know exactly what it is, but if there's a bit of an evidence base around the type of thing that you're doing, and for us there sometimes is, but not always, you can look to the literature and see, are there published evaluation studies that showed how many people completed or that type of thing, just so that you can have some evidence base behind the numbers that you have. We've sort of done that for ourselves at this point, because the analysis that we did was a forecast, and ideally the reason for that was to sort of set up the model and plug in the best numbers that we had at our disposal right now, with the expectation that as the years roll on and we have actual data coming in and we actually know what some of these things look like, that we can plug in real numbers based on our experience. So where you're forecasting, you're really relying on the literature. So for us, like with dead weight, I had mentioned the stages of change literature. It's also known as the trans-theoretical model. If you're working in the area of health promotion, that's basically sort of a theory that, when people come to a program that's aimed to sort of change their behavior in some way, they're all at various stages. So some of them they're not even at a stage where they're really sort of contemplating that change. Some are thinking about it. Some have already made an attempt. Some have already made several attempts. So you sort of can start to tease out the profile of different people and understand how likely they are to sort of achieve that behavior change based on sort of where they are in that model. So that's one area where, like for us, that's been helpful because we do health programming. Other areas, I'm not sure what the literature looks like, but basically wherever you can do some research to have a bit of weight behind the number, note that it's an assumption, that it's a proxy value, and then where you can put in actual values, that's obviously better. But just as long as you're not putting in a ridiculous number that's opportunistic. I don't know if that answers the question very well, but the person asking the question is touching on one of the challenges of social return, which is that some of those things, it is an exercise in trying to quantify ultimately the unquantifiable. So at some point you have to make a reasonable assumption, use your judgment, and where you can have the support of the published literature or other programs, that's helpful.
Okay, thanks, Craig. Another question, sort of along similar lines, is there a bibliography for some of the technical issues you were talking about? So, for example, social discount rate.
Bibliography. Not that I'm aware of, but if people go to the International Network's site, that's the body that standardizes the method, and they produce supplementary guidance for a lot of things. So you can actually, when you become a member, you can actually log into their site, and then they have additional resources for practitioners that will provide more detail around some of these more nebulous concepts within the analysis. So they have the standard guidance, which is available publicly, but when you actually become a member of the network, they make available to you more resources around how you might go about that. The other thing is on that site, some of them are public, but there's more available to people that are registered. They have case studies that people have submitted when they've actually done social return on investment analysis on their programs, and they range from all different sectors, like different types of things, not just health like what I've been talking about. And you can see how people make their assumptions and what they include and what they don't include. So there are resources, a lot that comes from the international network. I'm not aware of like a sort of centralized sort of repository or bibliography beyond that.
And could you just repeat the name of the network and the website?
It's the International Social Return on Investment Network. So if you just Google that, it's the first thing that pops up.
I'll for people on the line, I'll paste that into the text chat feature in just a moment. So, great. Another question coming in is from Shirley, and she says, "Is the average amount spent annual?" And it's hard to understand without context, i.e., relative to spending on other foods. How much in other so-called healthy countries where obesity rates were low?
Can you repeat that question?
Sure. Yeah, I'm just struggling to read it a little bit. I think it might be missing a word or two. I think she's referring to the numbers on fruit and vegetables. I'm not quite sure. Is the average amount spent annual? Hard to understand without context. For example, relative to spending on other foods, or how much in other so-called healthy countries where the obesity rates are low.
I mean, we didn't really benchmark that against data from other countries, and I think that would be fairly hard to do, just because of just cultural differences from country to country, for example. You know, what people eat varies very dramatically from one country to the next. So we were really looking at we were interested because we work only with Canadians. What do Canadians do in terms of fruit and vegetable? I don't, and it was a spending survey, so I don't know how, we can't really say what that translates to in terms of numbers of fruits and vegetables consumed. So, yeah, I don't have a great answer for that, but what was relevant for us in the context of our analysis was the Canadian data.
Okay. Great. So another question coming in from Shirley again. She says, would be interested to hear more about reactions to the $2.37 return on investment, and how good is it perceived to be? And she says, what does deriving value enable senior leadership in the agency to do?
Okay, so that's a good question. I'm going to read into that question a little bit, because one question that I often get is around sort of how to interpret the ratios, and I think that's what she's getting at. One thing that we're really cautious about is, because we have more than one ratio, right? We have our high level $2.37, I think it was, for our overall fund. But we also work with firms and our funded partners to generate ratios for individual interventions. So it's a more sort of holistic type of social return on investment analysis. And the reason why we did the high level one was to sort of standardize some of our common indicators and develop standard proxies that get applied at that lower level. But because we have, you know, a number of these bubbling up, the question becomes like, well, what do senior managers actually do with all of these? And so, you know, we have seen different types of interventions do this analysis and obviously come up with different ratios. So obviously some ratios will be higher than others. And the question to me always comes is, you know, can we compare them? Is it better to invest in things with a higher ratio than a lower one? And it's very, very difficult to do that. In fact, we really can't, because the context of the program that you're doing the analysis on sort of intervenes there and makes it impossible to compare. So speaking in generic terms, because I don't want to present other organizations' results for them, but we have one initiative where it was purely working on one outcome, really, which was physical activity. Then we had another initiative that was working on a range of outcomes, from physical activity to healthy eating. They had crime prevention, they had skills building, they had a number of things. They were working with an at-risk population, and so they had just a web of things that they were doing with that group. The ratio for the latter, the one that was working with the high-risk population, was significantly higher than the ratio for the first one, but the first one was still pretty good, where it was just working on one outcome, which was physical activity. And so, like, when you put them side by side, it looks like the latter one is better, but it's not actually the case. Like, that program did a lot, but it did it with very few at-risk, vulnerable individuals. So that program had a reach of about somewhere between 250 and 300 people, whereas the one that had the more moderate return reached, like, over 55,000 Canadians. So it was a much more intense program. So what the ratios actually do is they, in a very real sense, make tangible what the programs are trying to achieve. So like the things that we would have forgotten about that high risk one, like the crime prevention benefits of it and the healthy eating component and the skills building, all were assigned monetary value, and that turned up in their ratio, and that then became part of the discussion. So the discussion wasn't, do we do more high risk work versus less on these very simplistic interventions that are just doing one thing. It was, okay, there's value in both, and what's the right sort of balance that we want to strike between the two? Because there was a recognition that, okay, well, that first one that was just doing something very simple actually did that very successfully with a huge number of people, and therefore generated a lot of value for Canada, right? Whereas the other one did a lot for that small amount of people, but that, you know, you can't really compare them because they're very, very different. So when it comes to senior managers, never a good idea just to drop the ratios in front of them and walk away because they won't necessarily have the detail around not only what that program was, but what fed that ratio, because they won't always be the same things. That made any sense?
Yeah, that's great. I think that offers a lot of clarification. Another question coming in. The question is, does one use opportunity costs or financials in SOR? And a similar question, what's the difference between cost and value in the context of an SROI analysis?
Opportunity cost, I suppose you could. I don't know what that would look like specifically, but I don't see any barrier to it. I mean, it is a form of social value. What was the second part of that question?
The second part would be, what's the difference between cost and value in the context of an SROI analysis?
Right. Okay. So the most helpful example of that is with the life satisfaction technique that we're teasing out, and the fruit and vegetables. So you might pay very little for your fruits and vegetables, but the gain that you get out of them, as revealed by the life satisfaction model, will be far greater than what you pay. So it's more than just the cost. It's you buy the fruit and vegetables to obtain the benefits that accrue to you for eating them. So they improve your health. And so really what we're getting at with the life satisfaction model is the reason why there's that big monetary value attached to it is when you eat lots of fruits and vegetables, you do tend to be happier. And why do you tend to be happier? Well, it's probably because you have a healthy diet and therefore you're healthier and you're able to achieve more with your life. So that it's a very complex relationship, but that's why the model works, is because all these variables are positively correlated. So the value is not what you pay for the food. It's what you gain from eating it and the benefits that accrue to you by doing that behavior. If that makes any sense. And actually see if people are like typing like
yeah, for people on the text chat, they can type in and answer if Craig's answered your question, or if it raises another question for you, let us know via the text chat. So that would be great. Craig, anything more to add to that before I pose the next question to you?
No, unless that wasn't a good answer and someone wants more.
So next question coming in, can can SROI account for structural impacts, or is it more suited to looking at health behaviors?
Structural impacts, like, can they give an example?
Yeah, so Janice, if you're still listening, if you can give an example, and maybe Craig, if you can read into the question a little bit and make some assumptions.
Sure. So I would assume that what they mean is, a lot of the examples that I give are like when we try to motivate someone to change their behavior, but are they, the other type of programming that we could invest in is we could make a change in an environment somewhere, which would then lead people to just demonstrate a behavior whether they really want to or not. So you build a park in a community that didn't have one, for example, or you put a grocery store in what was otherwise a food desert. Yes, you could apply a social return on investment in that scenario, and it would, in fact, some of the valuation techniques that I went through, like revealed preference and life satisfaction, would help you tease out some of that more systems level change. It doesn't necessarily have to be at a individual's perspective. The other place where that might come in is a stakeholder could be a system. So for us, we didn't really go there with our analysis because we were trying to carve out an argument for healthy living programming as distinct from chronic disease prevention. So we wanted to build an argument around that if there's value in just demonstrating healthy behaviors for people, but we could go the next step and articulate how that also translates into systems level benefits, so that if people live healthier lives, they get fewer chronic diseases, and that alleviates a burden on the health system. In that case, we would articulate the health system as a stakeholder, and we would build in some proxies probably around the economic burden of illness and have a bit of a cost avoidance argument as part of that social return. So yes, you can absolutely look at systems level change from a social return on investment analysis. It's interesting that they asked that question, because we didn't go there because we have a very well developed economic burden of illness argument already sort of place, and what we were sort of missing was what's the more immediate value of the stuff that we're doing more for people than for the systems that they interact with. So that's why we went about the way that we did, and that's not been without controversy, to be honest, but I think it's an interesting perspective to take on it, because, if you ask the average Canadian, they probably really don't care how much their behavior saves the health system. The average Canadian doesn't, but they might care, for example, that people who are healthier tend to be happier or tend to make more money, which they do, those types of things. So we wanted to sort of build that up where we hadn't seen it before.
Thanks, Craig. And I see that we got confirmation from Janice that you've answered her question, so that's wonderful. So next question we've got coming in. I think this is in reference to the slide talking about the costs of fruits and veggies and exercise. So the question is, for clarity, do Canadians spend $500 and $380 per month or per year on veggies and exercise?
Per year, per person.
Hopefully that answers your question. The next question is coming in. How is SROI different than traditional health econ approach, whereby increased physical activity leads to health-adjusted life expectancy, and that gain can be quantified in dollars?
Well, I think that's actually touching on some of what I was just addressing around the distinction between the some of the traditional approaches, which are also really good, and shifting towards more of an immediate, what's the return on our investments in healthy living? So a lot of those arguments depend on sort of like, we're not looking at diseases here. We're working with people who don't have a disease, and we're trying to prevent it. We wanted to place a value on the behaviors that we want to see them demonstrate in the short term, but also over the long term. So nothing in our analysis touches on sort of the economic burden of illness, because we wanted this argument to be distinct from that. Not to say that this is better than that. I think they're very complementary, but we didn't want there to be any overlap between them, because we were really trying to sort of tease that out as distinct from that type of argument. So those can be very instructive. One of the reasons why we did what we did is because there was a request from our senior management at multiple levels that they wanted something else in addition to that, because anyone who's sort of gone through that literature around the economic burden of illness and whatnot, we're talking like billions of dollars over long periods of time, and they felt that from an engagement perspective that it was difficult to get people to really process that type of information, because the numbers were just so huge, and it was also overwhelming, and it seemed so long-term and detached from what we were doing. So when you think about the kinds of programs that we support, it's things like after-school activities for youth. For example, we've done a lot of that. Do we really want to say that we're going to attribute disease prevention and cost savings in the health system over the long term to that? Probably not. Like, I think we want to say that we influence people to adopt healthy behaviors in the short term, and hopefully that translates into habits, that we put them on a different trajectory than they might have otherwise been. But I don't think we want to say that that kid won't get cancer when he's 65 because we funded the Boys and Girls Club in 2015. It just felt like too much of a stretch for us, whereas it felt like a bit of a niche spot for us to sit within, where we say, well, we might not want to do that in this context, but we can say that if we get this child to demonstrate these behaviors over a shorter period of time, that there are some benefits that accrue to him and society more broadly, and that we can value that. So we were trying to set up a distinct argument from the traditional economic burden argument. And when I say economic burden, I also mean things like health adjusted, like the QALYs and the DALYs and HALE and all that type of thing. They're all very well developed, but we were asked to do something that was a bit different, that was more attributable to the types of programs that we support. Sorry, that was long-winded, but it's a really good question.
Perfect. I've got a few more questions coming in. We've got about 5 minutes left. Two sort of related questions here. How long has the SROI been used in your programs, and will the center be sharing the results of the SROI analysis on interventions so that partners can learn from these best practices or interventions that are or aren't working or providing high return on investment?
So we've been doing this, I would say, close to 2 years now. We did our strategy level analysis, which wrapped up last 3 or 4 months, I'd say. And then we've had probably 4 or 5 of our funded projects complete analyses as well, and we have a few more that are underway now. And those have been supported by consulting firms like CDPAC Strategies. So we're sort of at the early stages of our work, but we're actually quite far along as well, because we've got some pretty tangible results to share. Around sort of sharing results, I think we need, yes, I mean, we don't want to hoard it to ourselves. I think we need to sort of figure out how we're going to mobilize that. In our case, some of the ones that are done at an intervention level, well, all of them, we don't really own those reports. Like, they're commissioned by our partners and completed by the firms that they engage. So, I mean, they're often quite willing to share them, but we'll probably have a bit of a discussion about what we want to do with all of this next, so that people can see how we've set up the models and what the ratios look like, and what we include, what we don't include, that type of thing. So yes, we're not going to hoard it. I just think we haven't really settled on sort of a process around how that will get out there in the ether. Hoping that we have a journal in our branch that we can do some publishing, some peer-reviewed articles around this. So watch for some of those. Those will probably start to pop up in the next year or so, I would imagine. But beyond that, we'll think about other ways that we can share information.
Yeah, I'm sure that lots of people are looking for those that kind of information and learnings. So one more question coming in, and it says the interest was to look at people who are healthy and don't have disease in the analysis. Were certain inclusion-exclusion criteria applied in the sample selection? And if so, what kind of criteria were used to ensure that the sample only contained healthy individuals?
Well, we forecasted, so we're not looking at specific people right now. I wouldn't say that we're looking at healthy versus not healthy people specifically. It is a health promotion and disease prevention program, so most people won't have a disease, and we're trying to stop that from happening in the future. I wouldn't say that we would, in any of our programs, exclude anyone who would be living with a chronic disease. But the intervention would not be focused on that. But we say that we take a population health approach to our program, so we're not really targeting specific diseases or that type of thing, or specific people within the population. So anything that's in our model is drawn from sort of representative samples of the population writ large. So that would include everyone. So that survey on household spending, those are just the figures for Canadians as a whole. And the Canadian Community Health Survey, that's representative for the population as well. So we don't really make that distinction internally.
Great, thanks for clarifying that. And with our final minute here, Craig, maybe you want to leave us with some last thoughts and any key resources that you think people might be interested in looking at.
Well, I mean, I hope people enjoyed the presentation. I know it was packing in a lot of information. I would say I didn't really go through all of SROI in any great detail, so you had a bit of a high-level overview, and really The second half is really focusing on, what most people find the most interesting aspects of social return, which is the valuation piece. But actually, the most difficult part of this is really having data to do this. So that's something to really consider, is that like when we're working with organizations that we're encouraging to do it, a lot of people get caught up around like, well, how do I monetize these things that are very intangible? I would say that's actually the easy part. The hard part is, how do you measure the outcomes that you meant to achieve? Because most people have a really difficult time doing that. So just like prior to getting involved as we have in social return, like we've done a lot of work internally to develop our quantitative measures of outcomes that we were interested in achieving. And so that meant that we were sort of in a good place to start to do this. So if I had any parting words, it would be, don't get too caught up with the valuation, although that's generally what people are interested in. Like if you're really looking to do this, what you really need to worry about is evaluation and getting that right, because often organizations don't have a lot of data on what their outcomes are. And if you can't quantify your outcomes, it's very difficult to monetize them, right? I mean, you can't unless you're just forecasting. So those would be my parting words. If people are interested in more information around this, there's lots on the web on the international network. Right? I would encourage people to watch that Barcelona video that's embedded in the Prezi. I'm sorry that we couldn't play it. I've never done a webinar, so I didn't know how that was going to work, and it didn't work terribly well. Lesson learned. That I'm afraid only available in English, of course, because it's produced by someone in Spain who was. So yeah, there's lots on the web that people can go through to get more detail on the various steps and whatnot. The international network is really the place to go because they have a lot of the standard guidance around all of this. So anything you see there is really what most people are supposed to be doing when they're conducting this type of work.
Great, some great thoughts there. So I want to take just a moment to thank you, Craig. It's been really a pleasure to have you here presenting, and I'm sure all of our attendees really appreciated hearing from you. So thank you for that, and I want to thank the Public Health Agency, and I want to thank all of our everyone who joined in today. Thanks for joining us, and hope you'll take part in future events as well. There's another event coming up this week that if anyone's interested, they can have a look on the CDPAC website. So with that, I think we can close out the webinar, and thanks everyone, and have a great day.